afternoon. 1 minute.
Madam Speaker.
Thank you, Mr. Naidu. Sorry, I couldn't hear that bell very well. Thank you very much. Welcome back, honourable members, and to our staff. I trust that everybody is ready to start off with vote 6. I see the honourable minister. So, but before that, may I ask the secretary to read the bill, to read the vote.
Vote for L, Western Cape Adjustments Appropriation Bill.
Thank you very much, Mr. Secretary. I recognise the Honourable Minister Mbombo.
Thank you, Deputy Speaker, Premier, honourable members in the House, and also the media, whoever is watching. Thank you for this opportunity to present to the House the adjusted 18 budget of the Department of Health 2021-2022 financial year, which we started at 27.4 billion, which now will be 28.2 billion. With an increase of 798 million. Speaker, I just want to switch off my camera now. I'll come back. Speaker, before I even talk about the budget, I just want to, I'm using this phrase, the good, the bad, and the ugly, which I use it at the time that we're presenting our annual report, so that to reflect on what has been happening throughout. The good part is about this budget has been afforded, and also many people who have contributed in finalizing this. Thank you to Dr. Keith Klute and the HOD, and also his team. I will thank them again later. Speaker, the good it's about, you are talking about the Department of Health in the Western Cape, the only department that has ever received a clean audit. Not only once, Speaker, not only twice, but 3 times. So having a clean audit in 3 consecutive years, and also even at the time that it was when the health system, not only in the Western Cape, but also the whole South Africa, had a difficult times in regard to fighting COVID pandemic. Therefore, I want to commend Dr. Klute. Thank you. There he is. Dr. Klute and your team for doing as such. Whilst we understand that clean audits alone, it's not necessarily the overall mark in terms of the performance, but it is what the South African system has put up just to ensure that the money we receive from the taxpayers' money through the provincial and national treasury, we could be able to use it accordingly. The good part, Deputy Speaker, it's about talking about our health system that has been strengthened. As one person quotes about when we are at the weakest moment, that's when we are stronger. Strengthening to such extent that where we are talking about the resiliency, the agility, which we have never have thought that we could be where we are if it wasn't for the pandemic. The good, it's about the public-private partnership. No one would have thought that if in case that we are short of bed, or if the private hospitals are short of bed, we could just smoothly could be able to transfer the patients, or even just having a conversation over the phone. No one would have thought that could ever happen. The good part is about the universal health coverage that we have keep on preaching about it. Some of us, even before we joined politics, we have always been the proponents of the universal health coverage, talking about the equitable access without putting a burden on the people, and also making sure that people get quality health services without even thinking about how it's going to affect them in regard to their economic status. Because currently we know that even if you are the have, the price of the medical treatment is quite very high, up to the level that some of them they don't end up affording, and then they come to the public. So this needs to be commendable. Speaker, talking about now the bed. This is the budget that we're presenting at the time that the health system, specifically the Western Cape, where we find that there will be a decrease in the equitable share in the outer years. The budget where we are talking about the national grants, for example, the training grant, human resource training grant, the infrastructure grant, already it's going to be decreased. The bed, it's about when the non-COVID services have to be de-escalated, whilst we're prioritizing COVID, which is, it shouldn't be ideally where that any other service should be prioritized over the other. Of course, the issue of the service rationing has always been there. It's part of the health system anywhere in the world, but I'm not talking about that. I'm talking about now when you see some of those other patients who have been chronic patients whom were paused during that time when we're specifically in the first, second to third waves, prioritizing the COVID, they have to be paused so that they could be only provided maybe twice a year in terms of their checkups. And some of them will find that their clinicians now have to be doing something else in regard to fighting the COVID, and then they'll be taken up by the others. So the non-COVID services have never been on holiday. They're always there, and we see now those patients coming back. We're talking about the mental health status, not only of the patients, existing patients, but also for the country as a whole. We are broken as a country because the COVID pandemic, in as much as that you might be still talking about the cases and all of those, but the impact related to the wellness of the population, the impact related to when the people end up being unemployed, where people now who used to be independent have to be dependent. How COVID has impacted on the families, where in some families you'll find that both parents are gone, the adults are gone, it's the children and so forth. So this is a part of what we're talking about, the bed. The bed, Speaker, it's about this December, because I'm presenting this in December. I'll never forget December 2020. I wouldn't want to have that December. Actually, no person in the health system, actually even in the cabinet, the Premier probably might even have said also this is some time, but keep on saying that we don't want the 2020 December. That is the December in the third wave, where in 3 weeks' time, where we lost almost more than 50 staff members. And then you count with the January in the third wave, almost 70 plus staff members that we lost in the Western Cape. In as much as that the total healthcare workers is about 192, which is only about 1.5, excuse me when I'm saying it's only 1.5, when I'm saying only, but what I'm trying to, it's relative. It's about, whilst there are many that recover, but the mere fact that we lost many colleagues, this one is one thing that we'll never forget. Not only about that, it's a time when, whilst other people were celebrating, baking and cooking during the Christmas Eve, but some of us were just on the telephone watching for an oxygen tank that was supposed to be carrying oxygen from Gqeberha, where we were worried that if that tank, with anything that would happen to that truck on the way, it would have meant that within 24 hours might have lost oxygen to the patients, because at the time, nobody in the Cape, not only in the Capes, but also in the coastal towns where they had much oxygen. Already at the time with the private hospitals, they were already borrowing oxygen from ours. We don't want to go back there, Deputy Speaker. The ugly part, Deputy Speaker, is about as health. We have always been assisting people with the information, whether you have got diabetes or hypertension or all of those. And our clinicians will provide such information, being informative and all of those. But when it comes to COVID, you'll find that people will rely not only on the Google. I'm not saying that it's not, it's completely wrong to rely, to do your Googling. We'll rely on their plumbers, we'll rely on their hairdressers. That information actually even end up overtaking the information that is being provided by us in regard to the vaccinations. We have got people, not only those who are vaccine lazy, vaccine hesitant, we also have got anti-vaxxers. The health system is where it's being taken to court, left, right, and center, not only for the vaccines, but also in some other aspects related to the medical legal hazards and all of those. So it's part of that. Lastly, Speaker, on the ugly, we're talking about all the social ills that are happening outside the health system end up being absorbed by the health system. So when they were presenting in terms of the unemployment rate, presenting about the GDP, presenting in all of those, it meant that these will be absorbed by us as the health system in order to address all those inequalities. Hence, we'll find that with the smaller money that we have to ensure that we reach out to as many people, irrespective that in some other places, the reason that people don't have access to the health services is because that they don't have the public transport and all of those. So this is the budget, Speaker, that I'm presenting. It's under the good, the bad, and the ugly. So the focus on this 798 million that has been added, it talks about the staff wellness in regard to the response to the COVID. It talks about the COVID response, and also it talks about other non-COVID services. It talks about the services that needs to continue, like the mental health, whilst we are in the middle of the COVID. It talks about the infrastructure. It talks about keep on sharing the information to the people through our dashboard and all of those. So in that 798 million, Speaker, out of those, the Presidential Youth Initiative money that we have received, we say thank you to the National for providing such so that we can have additional more human resources. The people, the national grants, unfortunately, there's been a 10 million decrease in respect of the Klipfontein. I also want to respond to the issue of the Klipfontein. Just the hospital stroke Klipfontein, I did indicate it during the first time when I am in my term that it will rise. It is going to happen. But as I indicated previously, that the reason that we ended up not rebuilding the same hospital, but now trying to get the bigger one and also bigger venue, because that small hospital, which is a level 1 district hospital, couldn't even cater for the people in the Manenberg area. Also, he had the limitation of the package of services. There was no women, there were no pediatricians, because it was basically meant for the emergencies during that time. But we didn't leave the people there without an access, because at the same time that it was decommissioned, because it wasn't closed, decommissioned. It was the time that the Khayelitsha Hospital and the Mitchells Plain Hospital also was being commissioned. In addition to that, the Heideveld EC that was happening at the time. But I'm glad to just to indicate, Speaker, that it's still going to continue. The hiccups related to what was happening related to service provider is beyond the health, because remember, health, we are the client. And then we have got the implementing agents, being, for example, the provincial treasury and the public works are the ones who have to oversee in regard to some of these aspects related to the contracting and all of those. Similar with talking about the Klipfontein, the Tygerberg Hospital, which is now the main tertiary hospital, that ended up also have to endure taking some of the patients who go directly to them, not only for the referral, the maintenance there, the money that is put aside, especially for the co-payment for the public-private partnership in regard to the maintenance of that hospital is part of this that has been added also into that budget. Deputy Speaker, other monies is also related to our over collection of the revenue. We're still collecting as much as we can, as much as that people are unemployed, as per the patients, in terms of the services that we render to the patients, those who could be able to afford, and also our surplus, because we still have got the monies that we said now, let's make it a point that we cushion the health system so that you don't chow all the money and then we ended up not having much. The various shifts, the one that I mentioned coming from the Premier and also Department of Education in regard to the Employee Health and Wellness Program is part of that. Speaker, I did mention our flagship related to the technology, because we have to continue providing people with the information, accurate information, data-driven, and also evidence-based. So that 35 million that has been shifted out of the department to the Premier for the ICT in regard to the support, and also for the public work to the public transport and public works in regard to the Bracken Gate facility and Boland, because we still have to be ready, as I presented yesterday, in terms of our 6-point plan in response to the COVID. Because we still have got the uncertainties, Speaker, in relation to the variant, we still have to make it a point that we ensure that we have this money in order to earmark it for the management of the fourth wave. Therefore, Speaker, having mentioned the fourth wave, I just want to share also where are we in terms of the statistics. As of 1 p.m. today, but even before that, as you recall that yesterday, I mentioned that in order to technically define a fourth wave, it means that you need to have a 30% of the 7-day moving average of the cases as per previous wave, which is in the third wave, our peak daily new cases, it was about 3,581. And then when you calculate the 30%, it gives you about 1,100. So officially, Speaker, I just want to mention that we are, as a Western Cape, in the fourth wave. And know that it becomes a shock in regard to that. But as we indicated earlier when we're doing the debate, is that we are ready with the fourth wave. And we've got our 6-point plan, our beds are ready. And in this budget, I've already mentioned in regard to the field hospitals the money that will be also to add to that. And also in regard to the staff wellness, because it becomes actually psychologically when you hear you're on the fourth wave and you're a staff, in as much as that majority of our staff have already received the boosters, but that alone, it does have an impact psychologically. That's why I mentioned that we are bringing a budget that will be focusing on the staff wellness. Lastly, Speaker, I just want to thank other people, other stakeholders, because we will never be able to do it on our own as health. We need everyone. I mentioned the private hospitals. I also want to mention some others, the hospital heroes. Some of you may recall when we once had the Cape Town Philharmonic Orchestra that was done for the staff. Those kind of smaller things where every gesture, because one of the other parts of the good is about everyone has always been supportive of health. In as much as that, you'll find that in other contexts, some people might be actually knifing us left, right, and center. The staff packs that we have received as far as from the CIPLA and all of those. Also, other private hospitals like the Medic Clinic, when they saw that we have got the high number of the elective emergency operations like the hip in some instances where they assisted us. The gift of the givers with the additional ward they gave us in the mid-trust plane, also some of the goodies for the EMS and also for the whole of the staff. I did mention the Old Mutual and all others who assisted us also with the taxi vex, even at the time when we needed quarantine and isolation. Old Mutual was always there. And everyone else, but lastly, to thank the people of the Western Cape from all walks of life. Fortunately, in every wave, I always make sure that I reach out, not only talking, having a conversation with the communities, but also to provide support to our staff. And whilst Dr. Klute every week has to do the preparation for the presentation so that people don't get left behind through the Premier Digicon, which is we are going to have it, I think, Wednesday, and also for the extended cabinet where the mayors and everyone have always been part of that, the clinic committees and every part of that, because it's not easy for the data in terms of the collections. It might be easier because we've got universities who are assisting us, but to make sure that it's packaged to such an extent that it could be accessed by everyone, and also to be uploaded into the system. We really want to thank the HOD for that. Not only about only the clinic, the audits and everything. So thank you very much, Speaker, and I will thank the committee and everyone else later. Thank you very much.
Thank you, Honourable Minister. I now recognise Honourable Windvogel.
Thank you, Speaker.
Over to you.
Thank you, Speaker. Good afternoon, Speaker and honourable members. Speaker, as the second year of living with COVID-19 pandemic draw to a close, and as we look back on the journey traversed over this period, I'm convinced that we owe our being to the healthcare workers. They have proven time and again that they are real heroes of our country, with doctors, nurses, and all healthcare workers who sacrificed their lives and paid the ultimate price so we could live. Speaker, during our deliberation in the annual report, the hardworking and dedicated HOD of Western Cape Government, Dr. Kluti, committed his department to consider our suggestion to build a wall of remembrance in honoring of the department's healthcare workers. I had hoped that these adjustments will make provision for that. I trust that it will be accommodated in the main budget next year. As we are experiencing the COVID-19 resurgence fueled by the new Omicron variant, we call on the department to prioritize the safety of frontline workers. This budget was supposed to respond to this, not only through provision of adequate PPEs, but also through provision of psychosocial support, as many workers are dealing deep emotional scars and burnout due to long shifts. In contrast to the modern diatribe that was spewed in this house by the Premier yesterday regarding his personal opposition to possible lockdown measures, health workers I have spoke to are worried about the impact of alcohol harms and the increase of trauma cases this festive season. Health workers want the Command Council to look into this when it meets. Speaker, this budget should make provision for more staff members in response to the resurgence. The budget does not make provision for this. Instead, makes allocation to cover overspending on nursing and medical agency services expenditure due to more agency staff being utilized during the COVID pandemic. The over-reliance of this department on expensive agency staff has not been given the necessary attention it deserves. We reiterate our call to the department to employ permanent staff and stop enriching employment agencies at the expense of the poor. Speaker, we welcome the additional 626.1 million from the national government to fund the 2021 wage agreement and the Presidential Youth Employment Initiative for health staff and assistant nurses. We hope this will be spent to recruit young professionals, particularly the medical interns who cannot get placement in the province. Speaker, we need to have an open and frank discussion in the province addressing the socio-economic determinants of health and the observed health disparities that have been deepened by the COVID-19 pandemic. It pains me that this issue is always trivialized by the DA members. Member Philander just yesterday mocked our call for full implementation of the NHI. She claimed universal health coverage is a success in the province and they are already implementing it. I wonder if she paid detailed attention to the issue raised in our last oversight visit when we were told that Worcester Community Health Center is sometimes unable to attend to all patients due to high number. Where was she when Sister Adams from Clubmas Clinic informed us that she has resigned from work due to unbearable working conditions as a result of dire staff shortage at the clinic? Where was she at the Swellendam Rayton Clinic about insufficient space in the clinic and the clinic has only one seasonal doctor? DA members must desist from playing politics with plight of the poor. Speaker, these disparities were also vivid in the province vaccine rollout, where millions were spent on the CTICC vaccine site when there were clear shortages of vaccine sites in poor communities like Khayelitsha, Mitchells Plain, and the Klipfontein region. After months of ignoring our calls for closure of the CTICC site and decentralization of vaccine sites to the poorer communities, the department finally heeded to the call and closed the CTICC vaccine site. With an egg on its face, the provincial government was forced to accept that its planned vaccine procurement plan was not only unnecessary, but it was also a dismal failure. As a result, 74.6 million for the vaccine program will be spent on other priorities. I want to call on the MEC to explain why this budget still makes provision to fund operational costs of the CTICC vaccine site when it has been decommissioned. While the department now wants to claim to be the first province nationally to reach 50% of vaccination of its entire eligible vaccination population, The reality is that we could have done better if it was not for the department elite's approach to vaccination, including the Premier false promise to procure 500,000 vaccine doses. While we welcome this progress, we must also give credit to the national government for its continual support to the province. To Premier Windy, who doesn't want to credit national government, I want to remind him of the words by the great Amilcar Cabral, who once said, and I quote, "Tell no lies, claim no easy victories, expose lies whenever they are told," quote close. Speaker, the ANC rejects this budget as it does not agree with the budget cuts under health facility management, which includes 48.5 million reduction for community health facilities and 61.3 million reduction for provincial hospital services. More shocking is this department failure to spend the 10 million earmark for rebuilding the GF Jooste Hospital processes. This will cause further delays to the process and indicate that the people of Mynenburg, Gugulethu and surrounding areas will continue to suffer until after 2030, as the provincial government is not serious about rebuilding GF Jooste Hospital. Lastly, I want to express my sincere gratitude towards the health workers, the real heroes in this pandemic. I thank you, Honourable Deputy Speaker.
Thank you very much, Honourable Van Vogel. I now recognise Honourable Brinkhuis.
Thank you very much, Honourable Deputy Speaker. Honourable Speaker, if the MEC for Health can give us the guarantee that the elderly here in the Western Cape can be looked after well when they are waiting when they are waiting to be helped at our local clinics here in the Western Cape. In the last winter, the conditions was very, very harsh. The cold was very, very it was freezing cold in this last winter, and we have seen our elderly standing in lines from the morning till the late afternoon waiting to be helped at our clinics in that freezing cold. If the MEC can indicate or guarantee us that this problem will be addressed and it will be looked at, then we can support this budget. Otherwise, the Al Jamaa Party, we don't support this budget. Thank you very much, Speaker.
Thank you, Honourable Brinkhuis. Honourable Maria, I see that you've logged in. Are you wanting to speak?
With your permission, Honourable Deputy Speaker.
You may go ahead. Oh.
Thank you. I wish to compliment the Department of Health and the Minister on a job well done. If a person is not sure, look at the scoreboard. Before you criticize a rugby team or soccer team, look at the scoreboard. The scoreboard shows our health department has done better than any other province in the country. Our recovery rate from COVID is 96%. And I challenge anybody in this house to produce better figures for any other province. I challenge anybody to show me a premier more dedicated and a health department more dedicated in fighting the scourge that came across us. You know, Proverbs 24 verse 10, and I'm sorry, I'm first God-fearing, then I'm my wife and my family, and then I'm a father to my children, and only then fourth place comes being a politician. In that order, and Proverbs says, 74 verse 10, if you fall to pieces in a crisis, there wasn't much to you in the first place. Listen to that. We never fell to pieces. Yes, there was crisis in health, budget cuts, PPIs, so much. We had to build a hospital, more than one, CCTV and Bracken Gate. field hospitals too. We did it all. And here we are with the best COVID results for recovery, 96%. We have the best health system. We have the most academic hospitals in a country. Count, if you don't believe me, British Tygerberg, Red Cross, Somerset, they're all teaching hospitals. They're all functioning properly. We have much to be grateful for, and we must be thankful, not boastful, thankful, that in spite of all the problems that came in our way, this province have risen to the top. So I think before pointing fingers in this house, be careful. If you point a finger, 3 others are pointing to, or 4 others are pointing towards you. Congratulations, Minister. Congratulations, Premier's Department in charge of health. You've done an outstanding job. Thank you.
Thank you, Honourable Murray. I now recognise Honourable Philander.
Thank you very much, Honourable Deputy Speaker. Please allow me to keep my video off due to connection purposes.
Sure.
Honourable Deputy Speaker, allow me to open and share News 24's headline yesterday that read, please listen carefully, Shadow MEC, open quote, of all the 9 provincial departments of health, the Western Cape is the only province to achieve a clean audit, close quote. This is my opening statement because I want to make sure the DA difference is absolutely clear. A province led by the DA is a province well governed. Deputy Speaker, during a pandemic, the provincial department managed to receive its 3rd consecutive clean audit. But Deputy Speaker, I also have no doubt that the members from the opposition will rise over and over again and ask the question what a clean audit means to residents in the province, and in particular to those in disadvantaged communities. So please allow me to clarify as we deliberate the adjustment appropriation to our health department in the Western Cape for 2021. In the AG's report in findings of the previous financial year, for the 8 other provincial departments of health, he details issues on key service delivery programs, which reporters describe as crippling to our healthcare system. This is especially clear when the AG documents that provincial...
Please just hold on a minute. I see that Honourable Nkondlo's got her hand up. 1 second. I'm very happy that everybody could hear my my interjections. Honourable Nkondlo, what's your point of order?
No, I wanted to check if Member Philander will take a question on lessons from Member Schaefer about clean audits.
Honourable Nkondlo. Honourable Philander, do you want to take a question?
Not at all. Thank you, Deputy Speaker.
Okay. Thank you, Honourable Nkondlo. Please lower your hand. Over to you, Honourable Philander.
This is especially clear when the AG documents that provincial health departments paid close to 2 billion rand out in negligent claims. Deputy Speaker, this amount is equivalent to twice the health facility management program budgeted for our Department of Health, which aims to ensure our facilities are maintained and conducive to provide quality services. Deputy Speaker, the 2 billion rand lost could only be classified as wasteful expenditure and gross negligence of the social contract with the people at the hands of the ANC. Deputy Speaker, so when the opposition questions what a clean audit means, we mean good financial governance in the interest of service delivery for all our people. I want them to remember this headline. Moreover, I want them to remember that close to 2 billion is lost in negligent payouts because care was not provided as expected from the system as a basic provision, and I want to call on them to hold their leadership to account. The ANC Shadow MEC for Health is in no position at all to tell us what quality healthcare looks like. Her party is allergic to quality service delivery, and we have no time for hypocrisy. Deputy Speaker, the new budget for this year will avail an additional 800 million to the Western Cape Department of Health, which we as the Democratic Alliance can welcome with a clean conscience against the backdrop of 3 clean financial audits. Further details of a budget that back our people can be seen in the reprioritization of an additional 211 million to fight the COVID-19 pandemic in the Western Cape, which will ensure that citizens receive the care when and where needed. We will back hope, Deputy Speaker. The 9 million rand for the acceleration of the implementation of the hospital and emergency center tracking information system, which is a proactive system used to ensure those who are in need of emergency care will be helped with urgency and proactively. 76 million for COVID-19 activities related to staff and facilities to make sure we do not turn away any patient, and 3.5 million for the strengthening of the Provincial Health Data Center, which has informed our recognized data-led approach in managing COVID-19 that ensured we save lives and livelihoods with the same level of urgency. Deputy Speaker, a budget that aims to back its people is one that prioritizes the immediate needs and that will support their health and well-being. The good financial practices as seen thus far in our management of the pandemic showcases how we can move with agility and manage both new variants as well as waves of infection. Deputy Speaker, in the Western Cape, we steer clear from the kind of mismanagement as seen by our colleagues in other provinces. It is even more discouraging to note this level of governance during a global pandemic where provincial government should not provide adequate care to appropriate standard. Deputy Speaker, as much as the African National Congress aims to reflect from their leadership style that informs this malpractice, in the Western Cape we lead and we take pride in tabling a budget, in particular vote 6, to back the residents of this province, all residents in this province. Agbare adjunct Speaker, sedert 1 Maart verlede jaar het baie gebeur en ons het baie beleef as 'n nasie en geen anders vir ons hier in die Weskaap. Adjunct Speaker, ons almal ken iemand wat geraak was of geraak is deur hierdie pandemie. Hierdeur wil ek tog vandag weer 'n beroep doen op ons gemeenskappe in die Weskaap. Jy wil nie in 'n situasie wees waar jy jou situasie kon verhoed het nie. Adjunct Speaker, as ons almal net kon besef die massiewe impak wat COVID-19 op ons daaglikse lewens het en as dit eers aan jou deur kom klop. Geen een van ons is kwytgeskeld van die impak van hierdie pandemie nie. Ons moet dus verantwoordelikheid neem as inwoners van hierdie provinsie om saam met die regering te werk om soveel as moontlik inwoners ingeënt te kry. Adjunct Speaker, die Weskaapse regering onder leiding van Premier Windy en die Gesondheidsdepartement onder leiding van Minister Mbombo toon ware en deursigtige leierskap deurlopend. We hold the best COVID response in the entire country, something recognized through various awards and metrics on a national level. Deputy Speaker, the Standing Committee on Health during our deliberations unanimously resolved to express our gratitude to the Western Cape Health Department. It's signed, it's sealed, and it's delivered. I disregard any opposing views today, as the opposition are opposing this vote for the sake of being the opposition because the facts are undeniable. And yes, Deputy Speaker, of course we are facing a budget crunch in the Western Cape, not because of corruption or the lack of leadership or incompetence, but because of obvious reasons, because of an ANC national government that has long ago forgotten what it is to be poor and has long forgotten what it is to be of service and in service to the people of this country. An ANC national government that is out of touch with the reality of what people are facing every single day. Deputy Speaker, the people of the Western Cape should know why exactly the ANC is rejecting this vote. Deputy Speaker and people of the Western Cape, the ANC is rejecting this vote because the ANC does not support an effective vaccination program to vaccinate as many people as swiftly as possible to save lives and livelihoods. Deputy Speaker and people of the Western Cape, the ANC is rejecting this vote because the ANC does not support the Western Cape government for making adequate provision for enough beds for oxygen, and for an adequate amount of health workers to take care of you when you fall ill. Deputy Speaker and people of this province, the ANC is rejecting this vote because the ANC does not support an effective booster program to provide booster shots to as many people as swiftly as possible in every community across this province. Die ANC kyk inwoners van hierdie provinsie vlak. Die ANC kyk ons almal vlak, maar ons gaan nie tot op daardie vlak daal nie. As the DA, we support this budget because during the course of the financial year, the appropriation has ensured above adequate care for COVID-19 and unrelated COVID care as well. Deputy Speaker, we have an outstanding track record in terms of service delivery reach and have proven that we do not need the NHI bill. This is just another trick from the ANC to steal once again from residents and centralize healthcare under their failed leadership. Deputy Speaker, on another matter which I would like to address today is the fact that the opposition claims that the DA claims to use its own money to provide public services. But Deputy Speaker, that could not be further from the truth. We know we are spending public money. But ironically and unfortunately, it is the African National Congress that does not understand that this is public money, as they fail to use it for primary purpose, and that is to serve the people, all people. Deputy Speaker, in conclusion, I wish to express on behalf of the Democratic Alliance our support for Vote 6, because while it will perform its primary purpose, it will also lay the foundation for broader societal well-being. Deputy Speaker, by ensuring that our healthcare system remains beyond reproach. Deputy Speaker, during this season, where we all are supposed to be in good spirit and health, let us all spare a thought to the families affected by this pandemic. Let our actions this season be that of responsible citizens. Deputy Speaker, we think about all our healthcare workers in all our facilities across the Western Cape on every level that will be working during this season to keep us safe and healthy. Deputy Speaker, afford me the opportunity to thank Premier Alan Winde, to thank Minister Noma French Mbombo, and to thank Dr. Keith Kluter and their respective teams for truly serving every citizen in this province with diligence and passion. Speaker, on this note, I also wish to thank our procedural staff, especially Ms. Namonde Jamke, for her procedural support to the Standing Committee, and every Standing Committee member for the enthusiasm you portray in your oversight role. Deputy Speaker, in the Standing Committee, we agree on a lot. That the Western Cape is the best. I do understand that during the debate, the opposition is the opposition is the opposition. I wish also to extend a special word of thanks and appreciation to our fifth floor support. Thank you for your value and contributions to this vote especially. Deputy Speaker, may we all experience a blessed and a happy festive season.
Point of order,
I thank you.
1 minute. Honourable Barnes, she was literally on her last sentence. Yes, what's your point of order?
Thank you, Deputy Speaker. Just on a point of order, Honourable Philander must not miss
Honourable Barnes,
the Standing Committee agreed.
Point of order. Honourable Barnes, that's not a point of order. What's your point of order?
Honourable Philander is misleading the House. The Standing Committee agreed on Dr. Klute being there always when we need him. Not that we agreed that the Western Cape has been the best. It has never been the case. Let Honourable Philander just correct that. Thank you, Speaker.
Yes, I understand that, but it's not for me to judge the information that has been relayed by Honourable Philander, so I'm going to leave it as such. Thank you very much. I now hand over to Honourable Minister Mbombo.
Thank you, Deputy Speaker. Thank you, members, for your input on the debate, on the budget. Member Van Vogel, Member Philander, Member Brenghuis, Member Marais, thank you very much for the input. Because now that there's this issue that has been now been raised now by Member Barnes, I think I should respond to that first. Deputy Speaker. Western Cape Health Department is the best out of the 9 provinces. I've already mentioned the issue in terms of the financial management and the clean audit. When it comes to the health outcomes, look at the quadruple burden of disease, specifically on the child health, on the maternal deaths, on maternal health, on the mental wellness in regard to the access also to services within 2 kilometers or within the 5 kilometer radius. That we have got the outreach of our clinicians going to other provinces, specifically in the Eastern Cape, where you want to reduce the issue of some of the children, like with the pediatric problems that are coming to the Red Cross or even to Proteskier and all of those. So Western Cape is the best in that regard. Related to the pandemic, to the COVID, whilst we might have been there, adapt as the Cape Wuhan when we started in the first wave, but each and every wave taught us something else. And we welcome that even our colleagues, not only from the national, also from other provinces, they do come and learn.
Which people at the meeting?
And come to learn for more lessons. So for us as health, we don't politicize health. So that's why you'll never hear me and say that MEC for whoever is here coming for lessons learned. We don't, because we see ourselves as as part of the health system in South Africa. We have to learn from each other all the way. Thank you very much, Speaker, about that part. Now, in regard to responding to other questions, first thing, Speaker, I mentioned the equitable share that will be reduced in outer years for the Western Cape. And I'm aware that it's going to happen also in Gauteng, whilst the other provinces will get more boost in terms of the money. I didn't hear any of the members who were actually attacking us in regard to the resources, because it should be worrying that the third populous province, because now we are after the KZN, where more people are coming to the Western Cape in search of the economic opportunities, education, and all of those. So that aspect of it, that in the outliers, there won't be any money, even for the AFDAC, member Brent Hayes. The AFDAC is crucial indeed, where we could be able to add the AFDAC in the clinics that probably have been there long ago, in some areas, in the rural areas, even the councillors and also the mayors from the council, they do assist us in some of the AFDAC when in need. The issue is about, because we are in the COVID pandemic, and also we have to protect other patients or everyone else. We cannot put everyone in the waiting room, in as much as that might have a 300-seater waiting room and so forth. You can't. You still have to leave the other chair in between. And also we know that in a closed environment, which is the case in most of the older health facilities, where there isn't much of the open space and also opening the windows, you cannot. So that's why the issue of people queuing outside, it always remains. Just making an example for Delphi, what Councillor Adonis Michelle did in regard to assisting in terms of the drawing, the 1.5 meters distance, so that people could be able to keep the distance. In the Didorans, not only that the community did that, but some NGOs will even come up and give people some cost passes whilst they are sitting there. So as I indicated earlier, we are responsible to render health services, but health is everyone's business. Again, on the issue of the resources, I did indicate that if the grants, specifically the human resource training, the conditional grants will be reduced, already reduced, it will have a huge impact on some of these. Again, it's beyond our control. What we do is about whatever monies that we have to make sure that we provide as much as we can. Western Cape is the best that it does have higher number of the adult population that is vaccinated, it is receive 1 dose per population compared to the others. So why not can say that is the best? We once led in the 18 to 35 age group in regard to the vaccinations. At the time, we were busy with the jabs before John. Why can't you say that this is the best? That even the president will use our data, the president or even the national, our data from the Sentinel and related to the trauma and the alcohol. That's the only data they are using. So who collects the data? is from the HECTIS, HECTIS, which is those emergency centers that are collecting the data in regard to be able to make the comparison. We are the only one, so we are the best. And then in response to also in other issues related to the disparities, I did indicate the inequalities, the unemployment, the economy. These are things that are happening outside the health system, but we have to absorb it. So when people are unemployed, it means that most people will be dependent, won't be able to go have a medical aid. It means they will depend on the public system. When people who are actually might be in the middle class and then their medical aids don't pay up, and then they ended up, we are absorbing those people. So we absorb everyone, in as much as that might have 75% of the population who are uninsured, only 25 who are insured, which is after Gauteng, at least we are the second highest for the for insured population at that percentage. But those people, not only when they end up not being paid, but you look in terms of how many private hospital investors. Start from Matsikama, closing your eyes, and then you can count. Therefore, it means that most of those people were in Beaufort West, yes, member bands in Beaufort, where you're coming from, mention one private hospital that a billionaire could attend from in the Central Karoo, for example. Everyone uses a public hospital. So when people will say that, no, we are focusing on the whatever, we are responsible for everyone, inclusive of the economic status. On the CTICC, I don't understand why Member Van Govel keeps on saying that it's the ANC who said must close that. This is a contract. At the time that we signed up a contract between the city, the government, and also with the Discovery, it was about because remember that the CTICC is meant for something else. The conferences and all of those similar, actually even with other sites, Deputy Speaker, like even the community halls that are owned by the municipality, they will have provided us the community halls for the use, knowing that once there's LGE, they might be able, they want it back so that they could be able to use the community halls. Similar with the CTICC, the contract has ended. So it's about do we revise and review or what? So it has ended. But at the time, it was about already now we've got the Athlone Stadium, and also now we are in the phase of taking more vaccines to the people. Actually, it's not the first time that we're taking vaccines to the people. The wellness bus, if you have been to the Fisanta crowd in all of these farms and everywhere, we have to use our buses that used to be used by the wellness for the primary school kids, where we took them to the farms everywhere. For making example of the Kailich, you should have even made example about the Kailich and the Mitchell's Plain for the access, because you are making an assumption that because there might be a lower uptake, it's because of accessibility. It's not. Kailich actually was the first out of the 202 at the time of the vaccination sites. By the way, we are the best. We have got more vaccination sites at the beginning than any other province, which is now we keep on reviewing. It was the Kailich Andile Msizi Hall and Solomon Chuku Hall, Site C and Site B. These were the first ones to have an outreach vaccination site. The vaccination in this province started in Kailich, if you recall. That's why we ended up having these. So when the other halls come in, already we've done that. Westgate Mall and Mitchell's Plain, where we brought even the pastors and everyone, it has been happening throughout everywhere. So it's not like just because there's a vaccine complementing other outreaches that are there. Yesterday, I made an example of vaccinating in the homeless shelters. It's us, we've been doing that. We've been everywhere. So, but each and every time we keep on responding to all of those issues around that. In regard to the staff support, I'm a health professional, I'm still registered. Dr. Klute is also a health professional. There's no way that we cannot prioritize the health professionals. We worked in these clinics, we worked in these hospitals. We understand how it feels. So when we presented it even to the standing committee, I'm not sure what page of the PowerPoint where we saw in terms of the support we provide, not only in relation to everything related to the occupational health and support, but also in regard, I did even mention that we were the only ones who have been giving extra 2 days leave, extra 2 days leave for our staff. which is very unusual, just to give 2 days leave for that, in addition to any other accolades in regard to that part of it. Related to the agent staff in the committee, this question was asked. That's why we keep on saying, when you see the name contract staff permanent for us, you must remember that the interns are contract staff. Also part of the nursing, they are contract staff. So it's not necessarily the contract workers, they are contract staff, although some of them will get it through the NPOs. So it's not about that, it's about all those staff are contract. In addition to that, you're still gonna need the agent staff, because you'll never know that there might be maybe, let's say, a bus accident, just making an example, where it will require trauma nurses or ICU nurses during that time. The province is the province that has got the highest number of specialists, clinicians, plus also from the nursing in regarding, as much as that our COE might be lower than in others. But for us, we have got all of these multiple layers of the specialists, so that they could be able to afford to respond accordingly to various disciplines in regard to that space. Member Brengesi, in regard to AFDAC, I responded to that. Unfortunately, we respond by case, as I indicated earlier. You get some Tani or whoever who might sometimes volunteer and say that, okay, we'll be able to assist in this regard after. Or in some cases, like in Goodwood, where we found a space through the city, and then people got them to be able to be channeled whilst they are waiting. In Kraaifontein, where normally is always full, there are times where we have to put a tent, but noting you have to protect other patients, because you don't want a situation and then you put people like sardines and end up infecting each other, especially in the case of the Omicron, which is highly infectious, for example, in this regard. And then in regard to Deputy Speaker, the last one, I did mention that we're in the fourth wave. I would have thought at least there was something that needs to be mentioned in this regard, in terms of us making a pronouncement in regard of the commitments that this House should do, especially for a member of N4 who has been on and on, making examples of the clinics or wherever, all of those, at least for the Western Cape, each and every area, there will be clinics. If there are no clinics, there'll be satellite clinic. If there's no satellite clinic, there'll always be a mobile clinic that always comes. We provide the whole package. And even during the COVID, that we even open new clinics in Ganetendal, in Elim, and all of those during this process. And also, actually, there will be more of those that will be, which is not so turning, but we've made a commitment, Phyllisdorp, and everywhere where we'll be able to offer all of those. But we can do as much as we can based on the resources we have. The Cape government provides, actually gives more budget in terms of the allocation you have. If you look at the proportion of the budget, of the money that comes from the province to the health, you'll find that compared to other provinces is highest. And as yet, now coming to the outer years of the budget, it will be quite challenging in regard to that aspect. Lastly, Deputy Speaker, I want to thank the Speaker, the whole House, and also the officials that are part of Parliament. The Standing Committee, through the Chair, Member Philanda, and everyone in the Standing Committee. Thank you for actually making sure that we are on our toes, so that we make a preparation when we come. Although Ad Hoc Committee is not part of this, I also want to thank them in regard to that. All my colleagues, I know that they always trust us in regard to making sure that we deliver in regard to the information that is being required. That's why for now it was about, do we have to announce, and also that we made a commitment, Premier from the beginning, as the chairperson of the Provincial Command Council on the COVID, made that commitment that we are not going to hide information under the table. It has to be there so that people can make informed decisions. The informed decision now, what we are asking you to do is to make sure you stay safe, especially during this festive, because we have got not only the pandemic, which is the variant now, which is highly infectious. At this stage, we don't know in regard to whether it is deadly. At this stage, we still have got less than two deaths per day in terms of the average. about 660 admissions average, and we still, in terms of the numbers, it's still low, but the infection is going there. So please, whatever you do, stay in your bubble. If you can't, make sure that you put on your mask, and also don't be, if you're going to gather, make sure that it's not in a closed environment. Open up the windows. And then lastly, it won't be a surprise when we see as many of the people in our ECs, because we are competing the COVID pandemic with other pandemics, which is in this case the mental health, especially of the young people who have got a non-organic psychosis, most of them, which is they're not necessarily mentally ill, but because of a substance abuse and alcohol abuse, they ended up having all this kind of a mental illness that end up clog our health system. And lastly, the chronic conditions, some of them that are not necessarily COVID related, but now people will come later, maybe not be able to breathe because of the hypertension and all of those, and then it competes with a trauma emergency through the accidents and all of those. So that's why I was saying, drive safely, make sure that you put a mask wherever you are. Thank you very much, Deputy Speaker.
Thank you very much, Honourable Minister. That concludes the debate on that vote. I will ask the Secretary to now read the 6th order of the day.
Debate on Vote 8, Human Settlements, Western Cape Adjustments Appropriation Bill.
Thank you very much, Mr. Secretary. I now recognise the Honourable Minister Simmers.
Good afternoon, Honourable Deputy Speaker. If it's fine with you, for as long as I have sufficient bandwidth, I will keep my camera on, but I've noted some of my colleagues, you hear them talking about the picture is standing still, so once it happens, I will switch off the camera with your permission, please.
Jacket, I like the jacket.
Honourable Deputy Speaker.
Honourable Marie, no interjections. Thank
you. Okay. Honourable Deputy Speaker, Honourable Premier, Honourable Cabinet members, Honourable members of the House, our honoured guests that are tuned in through very innovative methods today, but also our honoured and broad media covering these entire sessions since yesterday. It is Albert Einstein who famously said, "Learn from yesterday, live for today, hope for tomorrow," close quote. As a service delivery component of the Western Cape government, we make a tangible difference in the lives of so many people across the entire province. In fact, since this administration commenced in 2019, 29,083 residents have been assisted with a housing opportunity. These residents and their loved ones now live in a safer and improved environment. There has been a complete turnaround in their living conditions. The change is real, and the homes go along with empowerment and enabling technology. I had the privilege, Honourable Deputy Speaker, in November to hand over 70 certificates to emerging contractors who were part of the Contractor Technical Skills Training Program in the Overstand municipal area. It was the 36th US President, Lyndon B. Johnson, who famously said that not only must we open the doors of opportunity, we must also equip our people to walk through those doors. It was in Vredendal just over a week ago where I had the privilege to hand over houses to elderly beneficiaries. One of the beneficiaries, a 66-year-old Ms. Susanna van der Westhuizen, who has been on the local housing demand database for 28 years, said, and I quote her, "I am so happy today and I thank God for making this day possible. I have my house now. It's been very long, but I never gave up hope. And I'd like to encourage others to also be patient because their opportunity will come." Close quote. Haar hoop het haar deurgedra, agbare onderspeaker. Sy sê die weg was baie lank, ja, maar dit was die moeite werd. Ek moet byvoeg, soos sy haar deur oopsluit, met 'n traan in haar oog, skiet sy by die deur in en begin toe onmiddellik te bid uit dankbaarheid vir haar huis. Sy was gevul met emosie, omdat sy verlig is, wetend dat sy nie weer in 'n informele struktuur hoef te woon nie. Haar waardigheid as mens is herstel. Further to the creation and delivery of housing opportunities, and during the same period, we have ensured that 15,144 residents could become legal and fully fledged homeowners for the first time in their lives. This is a privilege, Honourable Deputy Speaker, so many of those before us never had. Finally, these residents are now also outright owners of their properties. So, while others, such as the EFF and the ANC, seek to disown our people through expropriation without compensation, we are saying no. Let us empower our people, particularly since ownership is true empowerment, because it is through these mechanisms that we restore our people's dignity. Just as the ANC failed to obtain the majority in Parliament earlier this past week, let us at every opportunity continue to reject, apologies, even the smallest inkling of expropriation without compensation. The ANC has done enough harm to our country. In fact, they are busy bleeding this country dry. Just as they have done this, so too do they want to deny you and I ownership of our properties. I say away with the ANC and all their small alliances, away. As the Western Cape government, we are only seeking to empower our people and not steal from them. Our aim is to uplift them and ensure a brighter and better future. But Honourable Deputy Speaker, please don't take my word for it. Earlier this year, we were in Khayelitsha to hand over title deeds. And 55-year-old Ms. Puiswa Sondobo, who was one of the beneficiaries, said, and I quote her, I am truly thankful to the Western Cape government for restoring my dignity and for ensuring that this house is now fully mine. It is unfortunate that my husband has passed on and is not able to share in this moment. At least I know he's smiling down on us. This house is ours and cannot be taken away from us. This has been a long time coming, and I thought it would never happen. Now I can leave a lasting legacy behind for my children and grandchildren, close quote. Speaker, uit die mond van die inwoners sê hulle verder, omdat julle duidelik wys hoe ons vir julle 'n prioriteit is. Deur ons lewens op hierdie wyse te verander en te verbeter, gee dit ons nuwe hoop en moed, wetend dat daar wel 'n regering is wat vir ons omgee. Hierdie Weskaapse regering werk vir ons en dien ons, soos 'n regering na sy landsburgers moet omsien. Hierdie is nie 'n regering wat om elke hoek en draai sy eie mense wil belieg en besteel nie. We have made the commitment to continue working for our people, to ensure they have access to housing opportunity and also ownership through a title deed. Even though the national government decided to stop the title deed restoration grant, this will not prevent us from continuing to hand over title deeds to residents across the Western Cape. Therefore, for this current financial year, a further 8,110 beneficiaries can expect to become fully fledged homeowners in the Western Cape. Die geleentheid om mense te dien, wetend dat ons 'n tasbare verskil in hul lewens maak, dien as 'n motivering om voort te gaan en meer vir al ons kwesbaarste inwoners te doen. Dit is deel van die redes waarom ons op ons bejaardes, persone wat met 'n medies gesertifiseerde gestremdheid leef, persone wat nou al 15 jaar en langer op die behuisingswaglys is, en 8 jaar agterplaasbewoners, maar ook in ons landelike gebiede ons plaasbewoners fokus. Achtbare Speaker, Deputy Speaker, we will never apologize for adopting this stance, as it is these residents in our province that require our assistance. Deputy Speaker, it is further vital that we directly address our people's needs according to our context. It's a fact that the Western Cape has the highest employment rate. More than 70% of the people living in this province are employed. Yes, of course, these are different forms of employment. Given this fact, it is also true that many residents would not qualify for a fully state-subsidized house, as their household income would likely exceed the R3,500 threshold. Given the conducive and inviting environment that this provincial government has created, it is not surprising that businesses across the country and even beyond our borders choose to invest in this province. People are aware that the benefits are endless, and this is also part of the reason why so many move here to make this province their home. Hierdie bring menigte uitdagings, veral omdat ons die nasionale regering nie die nodige befondsing na hierdie provinsie se kant toe skuif nie. Dit plaas ook geweldige druk op die plaaslike infrastruktuur en openbare fasiliteite, omdat baie meer mense nou daarvan gebruik maak. Steeds, deur hierdie en ander uitdagings wys ons egter dat die Weskaap die vermoë, kundigheid en visie het om dinge vir sy mense gedoen te kry. Uit alle weë sien burgers reg oor hierdie land dat die Weskaap strategieë en planne in plek sit, sodat persone se lewensgehalte baie beter kan wees. This is also true for those who are in what is commonly known as the gap market, where programs such as social housing and other rental opportunities, along with the finance-linked individuals subsidy program or FLISP, play such a critical role so that they can access affordable housing opportunities. FLISP, Deputy Speaker, has proven to be a favorite amongst residents in the Western Cape. Between the 2018-19 and 2019-2020 financial years, a combined 3,811 applications were received, and a total of 2,935 households successfully accessed the FLISP program in the Western Cape. The few that are rejected are usually based on the misrepresentation of marital status or regime, income, and or having previously owned property in the country. A young couple, which is 30-year-old Justin and his 25-year-old wife, Sammy Jo Williams, who, with the assistance of FLISP, acquired a house in the Connivers project, said the following, and I quote him, "We are tremendously grateful for FLISP, as not only has it helped us to acquire a property, but because there's a reduction in the bond repayment, we can do a bit more with the extra cash on hand. We are excited about our home and cannot wait to fully settle in the area. And we encourage others to also apply for FLISP as it makes a big difference," close quote. Deputy Speaker, having engaged an array of communities throughout the length and breadth of the province, many expressed their concern that those who earn too much for a fully state subsidized home or too little to qualify for a bond are missing out on a housing opportunity. And that is why we are also focusing on the possible delinking of FLISP as a mortgage option only. In this year alone, I have approved 3 deviation applications as we are still awaiting the National Department to approve the amended FLISP policy. Deputy Speaker, as a caring government, you listen to your people. Unlike others, we learn from our yesterdays. We take those experiences and amend our plans, models, and strategies accordingly so that it addresses the current reality. We are not ostriches where our heads are stuck in the ground. Instead, we adapt where it is required. Learn from yesterday, live for today, and hope for tomorrow. Ons het ons strategie ietwat aangepas om te verseker dat meer geleenthede binne die bekostigbare behuisingsmark geskep word. Ons wou verseker dat meer inwoners die geleentheid gebied word om ook 'n huis te kan koop. Houses, homes, ownership, dignity, security, jobs, skills development, real hope, rational expectation of improved living through real opportunity indeed, not in word, Deputy Speaker. And this now brings me to the budget, where we have an upward adjustment of just over 57 million rand. This means our overall budget increases from 2.353 billion rand to 2.410 billion rand. This adjustment will assist us to continue serving our people in a manner that will address our context. These funds are being allocated as follows. 8 million rand will be used as security costs to protect a particular property against further invasions. And this is rather unfortunate, Deputy Speaker, as these funds could have been used to unlock the creation of more housing opportunities. The funds were shifted from Cape Nature and the Department of Environmental Affairs and Development Planning, comprising of 4 million rand each. Deputy Speaker, my department is also shifting 500,000 rand to DEP to assist municipalities in conducting housing market studies which are needed for preparation of municipal inclusionary housing policies. The lion's share, however, of the additional allocation, which is 49.58 million rand, will go towards one of our priorities, namely affordable housing. This will ensure that approximately 1,000 FLISP applications can be assisted. In my 2021-2022 budget speech, I announced that we will reinvest in the affordable housing market by utilizing funds generated through the selling of houses and sites constructed from the Human Settlements Development Grant. This is making us less dependent on the grant in future. 900,000 rand is allocated to the Garden Route District Municipality for an affordable housing project within the George Central Business District, a first of its kind. 48.688 million rand is allocated to affordable housing projects done by the department in the Cape Metro. In this financial year, already 40 million rand has been generated through the selling of units in these projects. This will again be invested in more affordable housing projects in the 2022-2023 financial year. I'm also very excited, Deputy Speaker, to announce that the first FLISP-assisted house in a non-metro area, which is the Safer Fontaine project in George, was also transferred, and that the project has been oversubscribed by 300%. A clearer demonstration for the need of affordable housing opportunities you will not see. Deputy Speaker, this is also beneficial to our municipalities, as those who acquire a house also pay for the services, which means there's a steady income for our local authorities. Speaker, Deputy Speaker, ons strategie is so helder soos daglig. Dit beteken nie dat ons nie nou meer aandag gee aan die opgradering van informele nedersettings nie. Inteendeel is hierdie ook een van ons prioriteite, want deur informele nedersettings op te gradeer, verseker ons dat mense in beter en veiliger omstandighede woon. Daar is spesifiek hiervoor begroot, because as the adjustment budget will also now introduce the 457.429 million rand reallocation of funds from the Human Settlements Development Grant, and the reallocation of it will now be done to the Informal Settlements Upgrading Partnership Grant, or ISUPG. Inwoners van hierdie provinsie wat na ons luister vandag, ook so ons lede in die huis, moet weet ongeag waar u woonagtig is, moet weet dat ons in die Weskaap regering julle op kan staatmaak, want ons plan is realisties. Dit is werkbaar en ons begroot daarvoor. Deputy Speaker, as I conclude, I would love to inform the residents of the Western Cape that the Provincial Department of Human Settlements is committed to meeting their needs, and therefore we are focused on and zooming into the affordable housing market. This will ensure a greater access to a housing opportunity. And at this juncture, I would like to thank the acting HOD, Ms. Pia Maisela, my CFO, along with the executives and all senior and middle managers, as well as the entire staff component, who are the machinery behind what we do. Let's continue to show the drive and commitment to assist our residents in this province, as it is through your hands that we are able to completely and radically change people's lives for the better. I refer once more to LBJ, who said, if government is to serve any purpose, it is to do for others what they are able to do for themselves. Close quote. The future holds little hope for any government where the present holds no hope for the people, Deputy Speaker. Hope we must provide, and hope this Western Cape government shall provide. Hope we shall realize for people in need of hope. Real promise, real hope, bricks and mortar delivery. In the Western Cape, these are not just words. It is a joyful and rewarding to be able to do work that really delivers on promise, Deputy Speaker. At Human Settlements, our commitment is based on delivery. We commit to continue to deliver houses and homes. Whatever opens opportunity and hope will help to prevent crime and to foster responsibility. At Human Settlements, we commit to better living. At Human Settlements in the Western Cape, we deliver better living. It is, I feel, as the executive tasked with this portfolio, the only reason to be in politics, to deliver a better living for our people. I'd also like to take this opportunity, Deputy Speaker, to wish all the members of this House, my head of ministry, my entire staff, the administration, and all present, even virtual, a blessed and joyous festive season. Please stay safe, take care, and get vaccinated if you haven't done so yet. And by the grace of the Almighty, I do believe that we shall see each other again in 2022, as we will continue to deliver a better living condition to the people of the Western Cape. I thank you, Deputy Speaker.
Thank you very much, Honourable Minister. I now recognise Honourable Lily.
Thank you, Deputy Speaker. As I rise on behalf of the African National Congress today to reject this budget, I want to open with a quote from Amilcar Cabral, who said, and I quote, "Always bear in mind that people are not fighting for ideas, for the things if anyone in anyone's heads. They are fighting to win material benefits, to live better and in peace, to see their lives go forward, to guarantee the future of their children. Close quote. It was the Freedom Charter in 1955 which promised the people that there shall be houses, security, and comfort for all. This budget goes against the spirit of the Freedom Charter and the policy direction of the national government. Below, let's take a closer look at some of the provisions made through this budget. The overall appropriation increased by over 57 million. Over 49 million of the budget will fund increased demand for affordable housing projects in 2 municipalities, the Garden Route, the Garden Route District Municipality, where he hails from, and the city of Cape Town, his new hometown. What is this amount going to achieve in a province with a housing backlog of over nearly 600,000? Because of poor leadership in this department and across all DA-led municipalities, the housing list has been increased every year. It was better when they had member Brett Heron. At least there were glimpses of hope as housing delivery improved slightly. But ever since he left, the housing delivery in the city was totally a collapse. This MEC is clueless in terms of addressing the housing crisis in the province. It is interesting to note that in the Garden Route, nearly R1 million will be spent on George CBD project, which is in line with the ANC calls for inclusionary housing, nearly places of opportunities. How much of the allocation to the city of Cape Town will be used for the purposes of redress and spatial integration? What happened to the projects that were planned in 2017 when well-located pockets of land in the inner city were identified for low-cost housing? The DA, which has kept our people on the outskirts of the city and deprived them of housing opportunities, is now making available 8 million for security costs. Speaker, while we do not condone land grabbing as it hampers on many aspects of development, we have to acknowledge that our people do not need this level of policing, and our people are not crazy for demanding and actually taking land. It is conditions created by this DA regime that is depriving our people to the extreme. Amika Cabral has actually made a profound statement in this regard when he said, open quote, "It is not the existence of a race and ethnic group or anything of the kind that define the behaviors of a human aggregate. No, it is the social environment and the problems arising from the reactions to this environment and the reactions of the human beings in question. All this defines the behavior of human aggregate. Close quote. This 8 million should be spent on housing delivery and not enriching red ends. This relationship between this department and the red ends needs careful scrutiny. It is the same company that is used to protect the vacant rental housing units of this department. We must be told why are units remaining vacant when there are government officials who are already occupying them and pay market-related rental fees. This department spends millions on security to prosecute and victimize the poor who live in informal settlements. When white people live lavishly in these leafy suburbs, paying only 100 Rand rental fees, we need transformation of these rental stock units. Our people must also enjoy lives in the suburbs, and at taxpayers' expense. Such liberties are not only reserved for whites. Speaker, why is this focus of this department under this MEC on building housing in the Metro and Garden route? What about other municipalities? This department also failed to spend its budget allocated for 2 consecutive years to the tune of 150 million to the Transeft projects in Brita Valley. Contractors abandoned this project. Less than 100 top structures out of 2,000 have been completed over a period of past 3 years. The MEC promised to hand over close to 50 houses last December. To this day, this has not happened. What about Langebek municipality, who only received 2 million in the main budget? The department claimed that the municipality did not submit its business plan. Hence, it was allocated that amount. Only an oversight visit, the director for housing in the municipality showed beyond reasonable doubt that a business plan was indeed submitted. Now, why is this adjustment not correcting that situation? Even on the allocations transferred to the municipalities for the development of integrated housing plans, Langebek is overlooked. The only thing this MEC seems to be passionate about is issuing title deeds for housing that were built during MEC Matikizela's term, and wants to celebrate those as his achievement. People are growing tired of these lame excuses and blaming the national government for provincial government's failure as a Scheduled 4 and 5 competence. This means the MEC has a full role to play in housing delivery and not hide behind the national government. The ANC, Mr. Speaker, in closing, does not support this budget. I thank you, Deputy Speaker.
Thank you very much, Honourable Lily. I see Honourable Murray, you're in the House. Are you going to be taking up your speaking slot?
Yes, Madam, I will be taking it up.
Over to you.
Thank you so much. Speaker, I think the housing thing is something we must look at sensibly. You know, thoughts become your words. Seeing everybody's quoting somebody, I'm also going to now quote, but that is my own quote. Thoughts become words, and words lead to actions. And actions lead to bad habits sometimes. And habits form your character. And character will later on determine your destiny. Now let's start right at the beginning of housing. Why are there shortages of housing? Because people were promised free houses. You don't have to pay. So who wouldn't want a house? You leave your mother's house when you're 20 and you qualify for your own house. The family is broken up now. Free food parcels, free schooling, free university, free SASSA grants, and now free houses. Can somebody tell me who pays for all this? Who works and pays taxes to afford all these freebies? We're going to look back and go back to the drawing board about everything is free. Why can't people get a house if he's prepared to afford the rental? So there can be a revolving fund, money coming in continuously to build new houses. The houses must finance themselves. What I do want to ask the minister, what has happened to the waiting list of houses? Are you prepared to publish it? I've asked in Parliament already, publish the housing waiting list so that people can know their rights to a house. I want to see that list. Secondly, Minister, our inability to pass legislation that will exactly determine and define what the Constitution means by adequate housing. The Constitution don't say somebody has a right to a house. He don't say he has a right to a shack. He doesn't say he has a right to cardboard and to plastic. He says a right to adequate housing. Why has there not been any legislation to define adequate housing so that the courts don't become the legislature and so that the courts don't have to act as if they are the executive? The courts have their function, but they can only operate in terms of legislation. So I want the term adequate housing to be defined in provincial legislation. Is there a process that you must follow to acquire an adequate house, Minister? Housing is not a municipal function, it's a provincial function. You must see that there's legislation that determines a process people must follow who acquire housing, the stages they must go through to get ultimately to an adequate house. If you don't have money now, then there must be 2 or 3 stages you got to follow. Then the court won't take over your job. I support this budget, but I'm going to watch the minister if he's prepared to act on these issues. Thank you.
Thank you very much, Honourable Murray. Time's up. I now recognise Honourable Brinkhays.
Thank you very much, Speaker. Speaker Al-Jamal, we don't support this budget. Thank you.
Thank you very much, Honourable Brinkhays. I now recognise Honourable Maseko.
Thank you very much, Deputy Speaker. Deputy Speaker, I'm not going to switch on the video just for the stability of the connection. Deputy Speaker, before I start with my debate, I just want to, there is this story, I'm not going to quote anyone, it's my story. So usually when you go shopping, you take the trolley in anticipation of when you push it, it's going to move forward with you. And that is the idea. But sometimes you'll find you get a trolley, you push it forward, it goes to the right or it goes to the left. Sometimes you'll get another one, it will go straight as you anticipate that it will serve the purpose. But immediately when you put in the grocery, you'll see it now turning right or left. And then that is what I see, what I've been hearing as I listen to all the debates about our adjustment budgets. Honorable Member Lily, I'm so happy for him that today he managed to get his connection on time to be able to debate this vote 8. And I really salute him for his presence today to debate vote 8. The unfortunate part is that usually when the department comes to address us, you'll find that he's late to hear some of the information. Langeberg, they don't have only 2 million allocated to them. Now they do have about 9 million, of which 7 million has been added. And for his information, for the beneficiary database of Western Cape to increase all the time is because this government of Western Cape creates opportunities and job opportunities. And I don't want to be misquoted about this. People that come to Western Cape, they do come for job opportunities, not for housing. The ripple effect of that is they will need housing to stay closer to their jobs, where they get the jobs. And where do they get the jobs? In this government of Western Cape. That's the DA government, by the way. Now, Deputy Speaker, at a time when budgets across all provinces are under severe strain, we are pleased to know that the provision of housing in the Western Cape has been prioritized. And this is happening because of our commitment to redress and provision of dignity. For that reason, we welcome the increase of the Department of Human Settlements by just over 57 million. It's critical to note that over 49 million rands, or over 86% of this money, will go directly to creating affordable housing in the province through the finance-linked individual subsidy program, both in the Metro and in the George CBD. As the Western Cape has the highest employment rate in the country, most residents do not qualify for breaking new grounds as they earn more than 3,500 per month. But Deputy Speaker, if maybe I can do just a recap for Honorable Member Lily. On this adjustment appropriation bill, 212,575 rand has gone to Cape Winelands. Cape Winelands is not in George or Cape Town. West Coast has got 121,866. Also, West Coast is not in George or Cape Town. Again, this is what I mean, that if you are in the meetings on time, you will know the allocation, how did it go about. Deputy Speaker, therefore, unlocking affordable housing opportunities through the FLEAS program is so important if we are to give beneficiaries every chance of owning their own home. FLEAS gives first-time homeowners who earn between 3,501 and 22,000 rand, who have never received government housing support, the capital injection that they need, which make owning their own home a reality. We know, Deputy Speaker, that no government in this country will be able to provide a house to every person on the housing demand database. There simply is not enough funding from National Treasury. Even with the 57 million increase, the 2.4 billion budget for the Department of Human Settlements does not come close to being able to meet the high level of demand. It is estimated that we would need 100 billion rands to meet the demand here in Western Cape only. That is more than the entire budget for the province. So we need to look beyond government, and this is why the Western Cape is partnering with the private sector and creating policy solutions which will see affordable housing opportunities in and near economic hubs. The Provincial Inclusionary Housing Policy Framework, the first of its kind for any province, is currently being finalized by the Department of Environmental Affairs and Development Planning, and will ensure that mixed housing developments become part of the fabric of the Western Cape. But Deputy Speaker, we are going even further to combat apartheid special planning. That's why 500,000 will be transferred to the Department of Environmental Affairs and Development Planning to assist municipalities in conducting housing market studies. This lays the groundwork for municipalities in the Western Cape to develop their own inclusionary housing policies specific to their communities, and which will help turn the tide on the legacy of discriminatory special planning. The assistance to municipalities will further be bolstered through the transfer of 15.5 million to 4 municipalities. 1.4 million will assist in building the capacity of the Saldanha Bay and George municipalities in the development of their integrated housing plans. And because we see that all things fall apart at national government, the Department of Human Settlements will transfer 12.4 million to the City of Cape Town for its title deed restoration program, a program which is no longer being funded by the national government. And the Standing Committee has witnessed firsthand the importance of owning your home and the sense of community that it can bring. Last month, in this chamber, we heard directly from District 6 residents who have been waiting for national government to get its house in order. The frustration and the pain of residents, many of them elderly, was keenly felt. While the national department continues to be absent and unfeeling towards these residents and the justice that they are owed. We have tried on numerous occasions to engage directly with Minister Didiza and her department. We have sent letters and called on her to speak with us, not because we are trying to hold her to account, but because the inaction by the Minister Didiza's department have directly impact on the lives of residents here in the Western Cape. And despite the fact that every member of the standing committee, including the ANC, wants to hear from Minister Didiza, she remains silent. However, just giving a platform for their voice to be heard has meant that the matter continues to get the attention it deserves, and the Standing Committee will continue to engage and call on national government to recognize and care for the District 6 community. But Deputy Speaker, things continue to fall apart at the national government. While the Department of Agriculture, Land Reform and Rural Development have ignored District 6 residents, the Department of Public Works and Infrastructure, our national landlord, has admitted that at least 1,300 of its own properties have been invaded, and only by January will they finalize a contract for the issuing of evictions. Which means that only next year, after the contract has been awarded, can eviction notices begin to be processed. We cannot afford to have the wheels of government turn slowly, which is why an additional 8 million has been allocated to help our department protect their properties against further land invasions. While it is deeply saddening that this money could not be used for further housing development, it is non-negotiable and vital to protect housing units and land from invasions. Just last week, 126 units at Forest Village were invaded, and while the department was able to remove those involved in this premeditated invasion, damage was done to these units, which will delay the move-in of 126 families who deserve their own home. This is not a victimless crime, and we must be firm in protecting the rights of the most vulnerable who continue to wait while others attempt to jump the queue. Every sphere of government and every public representative has a role to play in protecting the dignity and the right of beneficiaries. In Grabo, 3,000 people are living on nationally owned state land without any basic services like running water, electricity, or sanitation infrastructure. Allegations have arisen that Minister Delila and her party promised land to community. The narrative suggests that they could buy the land in exchange for voting for the Good Party in the recent government elections. Now, whether these allegations are true or not, the fact of the matter remains that the local municipality now has the responsibility of serving residents on the land that it doesn't own, with money it doesn't have, because the national department failed to protect its land or take swift action once it was invaded. Will the national department support the local municipality and pay for the services which it should never have had to provide? That is my challenge to Minister Delil. I somehow doubt the minister will take up this challenge. The rot of corruption with the ANC has infected the not so good party. As much as they are in denial, the only vaccine for ANC and good is the Democratic Alliance. If they inject the DA difference, then the excellence in running the Western Cape could be seen across our country, and of our communities could have hope. The only hope for South Africa is this DA government. In closing, Deputy Speaker, we recognize that there are no simple answers to complex questions, and there are no quick fixes to long-term systematic problems. Housing in South Africa will continue to be a mammoth task and a great challenge, which is why I say again, every department and every sphere of government must play its role, protect its land and support the dignity of our people while looking beyond our walls to the rest of society to find innovative ways to give residents every opportunity possible. For this reason, Speaker, the DA support this vote. I thank you.
Thank you very much, Honourable Member. I now recognise Honourable Minister Simmers.
Baie dankie, Deputy Speaker. Weer eens, baie dankie vir elkeen se inset. U weet natuurlik, ek het op die 7de Desember voorstaande komitee verskyn, so enige relevante vrae vir julle wat op tyd was natuurlik, kon hulle in hierdie staande komitee sitting gevra het. But Deputy Speaker, it's quite telling that every time an ANC member in this House stands up they tend to quote people that they've long gone. Now, I know the ANC is 109 years old, and they are probably the ostrich that is still stuck in the ground. The problem is they're so old they can't even lift their neck at the moment. So in Afrikaans, there's a saying, "As you sien in the blind, and as you hoor in the doof." And I think that is quite fitting for the ANC of today, who we have been debating for the last 2 days. Because had the Honourable Member Lily, through you, Deputy Speaker, actually logged in early enough on the 7th, all of his questions would have been answered, and he wouldn't have been quoting incorrect facts, because incorrect facts are very dangerous in the public domain, which, through you, Deputy Speaker, the Honourable Lily is quite known for, given some of the things he has been saying over the last period. But the biggest problem, I do believe, Deputy Speaker, and I'm now going to respond on each party's specific matters. Once again, Member Lily, you have your facts totally wrong. But it's telling that you are in the ANC, but you don't know what your national minister does, Deputy Speaker. The national minister signed off for each province what is called Provincial Human Settlement Development Areas, or PHDAs. It was nationally gazetted. It determines where Provincial Department of Human Settlements must spend the bulk of their budget in. So you quote the Garden Route, you quote the Overberg, and. Kindly look up that specific, Honourable Deputy Speaker, through you to the member. Look up that gazette and you'll see exactly which 28 areas across the Western Cape has been gazetted. Maar as jy laat ook, Deputy Speaker, dan ga jy nooit weet wat om jou aangaan nie, want op 109 jaar oud is jou kop vast in die sand. Jy moet nog net verrek val aan jy voorbij. Deputy Speaker, and secondly, and I thank Member Maseko for highlighting exactly the expenditure per district, which once again is also reported to the Standing Committee, Deputy Speaker, to ensure that the members of the Standing Committee are empowered with facts, unlike certain members who love fiction, to ensure that the proper message is communicated to the residents of the Western Cape, to which we all have a responsibility when we took the oath of office as members of the provincial legislature. It's a pity, Honourable Deputy Speaker, that we do not see the EFF and the Good Party here, because between these two parties, the allegations are rife that they are encouraging illegal land invasions. They are stealing future prospects of human settlements by what they are doing today. And I would really love to encourage both parties' members in this House, through you, Deputy Speaker, stop encouraging illegal land invasions. Because of what is happening in Knoflokskraal, and most recently, it came to my attention, there's a Kransbos village, which is in the Garden Route. Yes, Deputy Speaker, to Member Lily, it is in the Garden Route, where similar Knoflokskraal tactics are being used. Act within the rule of law. Ensure that even your members...
1 minute, please. There is a point of order by Honourable Said. Honourable Said, what's your point of order? Honourable Said?
Take a question around the EFF. Is he able to take a question?
Honourable Minister, do you want to take a question?
Deputy Speaker, I'm responding to members' inputs as a part of the debate. The Honourable Member can put his question in writing, which I believe is the due process to do. So,
thank you very much, Honourable Said. You may proceed, Honourable Minister.
Thank you very much, Deputy Speaker. So, once again, stop encouraging or allegations of your members driving land invasions, because we are stealing from our residents' future, but we are also busy placing massive fiscal and financial strain on our local governments where these invasions are happening. And sadly, many of the non-metro municipalities do not have the fiscal capacity to address even their current needs in terms of bulk infrastructure, Deputy Speaker. To Member Marais, thank you for the compliments. You asked two pertinent questions. The Honourable Member, in terms of waiting lists, and I'm happy that you asked that question, because your local government or your local municipality, they administer the beneficiary waiting list. You can, through your local ward councillor, actually ask the specific information, but given the PI Act, you know, we will need to see how you can do that, but the list is available. That's why we launched the housing app for possible beneficiaries to update the information or to register to be on the housing demand database, Honourable Deputy Speaker. In terms of adequate housing, Deputy Speaker, that is a pertinent discussion point which if one looks at various case studies in the past, it has been effectively addressed. But once again, as you seen in the blind, as you were in the dwarf, sadly people want to read what they only want to read. Within the fiscal constraints that has been forced on our province, forced on this department, we are delivering in line with the mandate as per the Constitution. But it's how we as members in this House actually define a housing opportunity. Madam Deputy Speaker, in conclusion, I do want to take this opportunity to thank the Standing Committee, to thank my chairperson and the members, and really wish them a safe and blessed festive season. But also, when we approach the new year, please attend all your meetings, then you are empowered with facts. Thank you very much, Deputy Speaker.
Thank you very much, Honourable Minister. That concludes the debate on this vote. I now recognise the Speaker.
Thank you, Madam Deputy Speaker. Honourable members, we are now heading to the next order. The Secretary will read the 7th order.
Consideration of votes and schedules, Western Cape Adjustments Appropriation Bill.
Thank you, Mr. Secretary. Honourable members, I have to announce that it's currently 36 members in the House. I'll just give you a breakdown so that you are all appraised of the actual number. The DA is 21 people, 21 members present. The ANC has 12 members present. EFF has none. Good has none. ACDP 1, FF plus 1, Al Jama 1. Total, as I indicated, is 36. So we will be able to proceed because the House does correct. Honourable members, are there any objections to the votes 1 to 14 and schedules and the schedules of the Western Cape Adjustment Appropriation Bill?
No. No objections.
Yes, object.
No objection.
Yes, the
Yes.
ANC object.
We object.
Order.
Al Jama
Objection. Thank you,
Al
honourable members.
Jama object, Speaker.
The objection of the ANC and that of Al Jama will be recorded. So if I may, honourable members, as put the question, those in favour of the votes and schedules of the Western Cape Adjustment Appropriation Bill being adopted, please say yes.
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 Yes. Yes.
Yes.
Thank you, honourable members. Those not in favour of votes and schedules of the Western Cape Adjustment Appropriation Bill being adopted, please say no.
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 Thank you, honourable members. I think the
No is
yes.
heavy.
I think the ayes have it.
will never have.
No, just.
I think the ayes have it.
Are you
So
sure?
the votes and schedule of the Western Cape Adjustment Appropriation Bill is therefore been adopted. Thank you, honourable members. Now let us move to the next order. The Secretary will read the 8th order of the day.
Finalization of the Western Cape Adjustments Appropriation Bill, including the clauses and short title.
Thank you, Mr. Secretary. Honourable members, I recognize the Honourable Minister of Finance.
Thank you, Speaker. I move that the Western Cape Adjustments Appropriation Bill, Bill 6 of 2021, be finalised by the Western Cape Provincial Parliament. Thank you.
Thank you, Honourable Minister. Honourable members, there is no speakers list. I will just confirm the numbers as per this time. The numbers still order, honourable members, please mute yourselves. The numbers are still confirmed as per the earlier figures that I've recorded. Honourable members, are there any objections to the bill clauses and short title being finalized?
No.
No.
There is an objection from the ANC.
Yes, we object.
Objection from the
Al
Freedom
Jama
Front.
object, Speaker. Al Jama object.
To the title.
Thank you. You're objecting to the title. All right.
We object to some law.
Thank you, honorable members. The objections have been noted. Let me just put the question. Those in favor of the bill, clauses and short title being finalized, please say yes.
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 Thank you, honorable members. Thank you, honorable members. Those not in favor of the bill, clauses, short title being finalized, please say no.
No.
No. No.
Thank you, honorable members. I think the ayes have it.
Yes, Speaker.
The finalization, including the clauses and short title of the Western Cape Adjustment Appropriation Bill, B6 of 2021 is therefore accordingly approved. The names of the individual members present and their support or otherwise for the question before the House will be recorded in the minutes of proceedings to ensure a full record of the voting of the bill, on the bill. The Secretary will read the bill.
Western Cape Adjustments Appropriation Bill.
Thank you, Mr. Secretary. Honorable members, the bill will be sent to the Premier for assent, thereby ensuring the constitutionality of the bill. Thank you very much, honorable members. Before further ado, allow me to deal with the outstanding matter, and that is the matter that has been outstanding since yesterday regarding a point of order raised by the Honorable Said during the debate on the principle of the Western Cape Adjustment Appropriation Bill. The Deputy Chief Whip of the ANC inquired on a point of order whether the Minister of Education, during her speech, was casting aspersions on a member of the House and was therefore in contravention of Rule 59 of the Standing Rules. I undertook in this House to consult Hansard and rule on the matter as soon as I've had an opportunity to do so. Honorable members, I have now had an opportunity to study Hansard and wish to rule that I have found no substantiation whatsoever for a possible breach of Rule 59. I regard the utterances by the minister within the boundaries of fair political comment and within her rights to free speech, especially in the House as guaranteed by our Constitution. The aggrieved member will be within his right, honorable members, to refute the utterances of the Minister of Education using the available parliamentary tools at his disposal to do so. Honorable members, therefore, the point of order by Honorable Said is therefore not sustained. I rule. Now we move to the last part, which I think it makes a lot of sense after a long day and of course a long year to do this for the honorable members as part of the tradition that we allow political parties represented in the Western Cape Provincial Parliament to say a few words as we end the year, the financial year, the calendar year. I'll now afford the representatives of parties an opportunity to address the House. I'll give the opportunity. Let us please mute our microphones, honorable members. I'll now give the opportunity to the ANC.
Thank you. Thank you very much, Speaker. Premier, members of the legislature, all the officials who've made this session possible. It really is a pleasure on behalf of the ANC in this House to wish all of our members a productive constituency period, which will follow next week. A very safe festive season, a blessed Christmas to those who celebrate, and a very happy new year. And that wish comes from our benches of the African National Congress. I think, Speaker, not only has 2021 been a tough and a challenging year, but in fact, since the lockdown, life as we know it has in many ways changed. And at some level, all of us have a belief that we want life to go back to so-called normal. But we also know, Speaker and honourable members, that without a doubt that those affected most by this pandemic, those who live in poverty, those who are unemployed, those who are landless, and those who are victims of inequality, we know that they have been affected most. So I think the challenge for us as we end this year is not just a desire which says, let's go back to normal, but we have to think of ways that the normal that we started with actually, and we have to realize that that normal is unsustainable. And I think all of us should realize that the going back to normal is going to be a different kind of a normal in which, as this pandemic has shown, that we redouble our commitments, especially to deal with the issues of gender-based violence, the issues of poverty, the issues of inequality and landlessness. And while, Speaker, I know that many of us differ on the how, I think I can say without a shadow of doubt that every single member of this legislature wants the best for our province, wants the best for our country. And I think we should reflect on these issues. And when we come back, should really look at how we're going to park the differences that we have and do what our communities want from us. And that is to focus on the service delivery and going back to a situation which is not the same, but a situation is more sustainable and more equitable for all of our people. Thank you, Speaker. Thank you to the Premier and the MECs and all of the honourable members, especially from our caucus, our Chief Whip, members of the Poll Committee and caucus. I think we can look forward to a well-deserved break, but come back next year with a determination to serve the people of our province even better. Thank you, Speaker.
Thank you, the Honourable Leader of the Opposition. Honourable members, I now recognize the ACTP Honourable Christians.
Thank you, Speaker. Speaker, thank you for this opportunity. On behalf of the ACDP, it is with deep sense of gratitude to Almighty God and the acknowledgement of His grace that I wish you and all our colleagues, Premier, Ministers, well for the festive season that is upon us. The shops with all the buzz show us that Christmas shopping madness, Christmas is upon us. I wish you and like I said, you and the Premier, Ministers and colleagues a good rest, recovery, rejuvenation and rejoicing, a time well spent with family and friends. Thank you for a year we have spent in vigorous debate, and I believe this is to improve the lives of the people of the Western Cape. Thank you to all the members and friends for words of encouragement when we see one another in the corridors and the lifts, words of encouragement shared at times when we pass. Despite of the prevailing conditions, we have been spared by Almighty God to see the end of this year. May the festive season treat us all well, and may we have a joyous, prosperous, and abundant success for 2022. I want to leave you with a verse from the Holy Bible, Isaiah 9 verse 6. For to us a child is born, to us a son is given, and the government will rest upon his shoulders, and he will be called Wonderful Counselor, Mighty God, Everlasting Father, and Prince of Peace. With that said, stay safe and be blessed. I thank you.
Thank you, Honourable Christians, with those kind words. Honorable members, I now recognize the Freedom Front Plus, Honorable Murray.
Thank you, Speaker. Speaker, I wish every member of this august House an enjoyable, well-deserved holiday over the festive season. This House has been blessed with intelligent, efficient leaders representing all parties. They have the ability to lift this province to new heights of efficiency and economic stability. If we can operate and continue to operate as a barbarian team on crucial issues that require wisdom rather than mere cold facts. Speaker, and then talking about wisdom, I want to refer to Solomon because he's the epicenter of wisdom in my Bible. I want to go to Proverbs. Again, I want to repeat, if you fall to pieces in a crisis, there will be to you in the first place. Verse 24, it's wrong, very wrong to go along with injustices. Verse 27, and this is important, let us first plant your fields, then build your barns. Remember that? You cannot build a barn if there's no production, no food. That comes from Solomon. That's going to be our job. And verse 25, remove the wicked from leadership. Then authority will be credible and God-honoring. And don't work yourself into the spotlight. Don't push your way into the place of prominence. It's better to be promoted to a place of honor than face humiliation by later being demoted. If we observe those rules, I wish we could adopt it as the code of conduct for all members. But with those words of wisdom from Solomon, I wish the leader of the opposition well-deserved rest. He's an old soldier, and he is a very good soldier. Intelligent in every way, level-headed, and so is our Premier. And the two of them on your shoulders rest most of what the battle lines to be drawn will determine. I wish you luck. And the Speaker. Wow. I've never wanted to be a speaker, but after listening to you, Speaker, I wish I had the talent to be a speaker, even-handed, and treating everybody with respect. And you don't demand respect, sir. You command respect. For that, I want to congratulate you. Have a good day, all of you.
Thank you, Honorable Murray, with those kind words. We appreciate every cooperation we get from every member. May I then request the Al-Jama to address us?
Oh, thank you very much, Honorable Speaker. Speaker, on behalf of the Al-Jama political party, first of all, I want to congratulate the Western Cape government for a very successful year of debates and deliberations amongst the members. And yes, to the Premier and his executive, also a great thank you to him and his team. And I also want to mention that to all the different departments in the Western Cape government, especially the staff working so vigorously and always assisting us when we are on the premises of WCPP. And I want to also give a special thanks to the Secretary of the Western Cape government, Mr. Romeo, whenever we call upon him for any information, he's always there to assist us, be it in the working hours or even after working hours. He was always there to assist us when we call upon him. And also I would like to mention also the IT department at the Western Cape. A very big thank you and shukran to them. There's a brother there, Brother Siraj. There's our sister Candice. They're doing a tremendous job in the IT department. And yes, again, I want to say a big thank you to them. And all the members also of the Western Cape, a big thank you to them. All the chairs of the different committees, very big thank you to them also. And I wish for each and every member and everybody at the WCPP a well earned rest over the festive time, and may they have a happy Christmas and a joyous Christmas, and may we see each other again in the coming year, next year. Thank you very much, Speaker.
Thank you, Honorable Brenkes, with those kind words. Honorable members, I now recognize the Democratic Alliance.
Thank you. Thank you, Mr. Honorable Speaker and Deputy Speaker, Honorable Premier and Cabinet colleagues, Honorable Leader of the Opposition, Honorable members of the Provincial Legislature, all staff members of the Western Cape Government and of the Western Cape Provincial Parliament. On behalf of the Democratic Alliance, I rise to wish each and everyone a peaceful, restful, and a fulfilling festive season. We hope that the upcoming season will be one marked by reconnection with family, friends, and loved ones whom we may have seen less of due to the various precautions associated with COVID-19, and to reconnect with ourselves as we rest and recover from what has no doubt been a challenging year, Mr. Speaker. Please remember that we are still in a pandemic that poses much uncertainty for the future. Please remember also that the precautions advised, such as social distancing, sanitizing, wearing of masks, and so on, are designed to protect us. As we reconnect this festive season, please take all precautions so that we might all return in the new year well rested and ready to continue to work and the work of building our beautiful province and an amazing nation in South Africa. God bless.
Thank you, Honorable Fritz, Honorable Minister Fritz. We appreciate those kind words. Honorable members, on behalf of the Western Cape Provincial Parliament and of course the administration, myself and the Deputy Speaker, we appreciate the cooperation. It's not easy to lead other leaders here, especially where times differences can be quite tough, and to manage those on behalf of this institution, it's not an easy task. But we appreciate that we are able to work together. We've seen tolerance, we've seen the ability to rise above differences, to rise above ideological inclinations in order to ensure that we advance the cause of democracy and to make this institution work. And for that, we appreciate your cooperation and support. To every staff member of the Western Cape Provincial Parliament, you may not understand how much you mean to us, but everyone has thanked you, either having worked with the chairs in the committees, but members have appreciated what you've done. But each and every one of the 116 members of staff and the interpretation services, the translation services, thank you very much for all the job that you've done to try and help us communicate, the sign language to help us communicate in isiXhosa, Sitet, and that one's can Brat Afrikaans, and we can speak English. fairly without feeling otherwise and being prejudiced in any way. So thank you very much for all of that. I want to request that as we enjoy ourselves in the festive season, and of course, we do so safely, and request that we exercise caution as we drive in the roads. But of course, honorable members and staff and all family members and our loved ones, we've lost people that we love, and I wish to extend my deepest sympathy and my heartfelt condolences to all of those who have departed, and may their souls rest in peace. I'm going to ask the House to observe a moment of silence as we're about to adjourn. Thank you, honorable members. May their souls rest in peace. So we pray, and hopefully every one of us, those who celebrate Christmas, will enjoy Christmas, and I would like to say Happy Christmas in advance and a joyous festive season. May God bless you all. The House is adjourned and the business of the day has come to an end, and that concludes the year for this Parliament. We'll see you in the 2022 calendar year. Thank you.
Thank
Thank
you,
you, Speaker. Bye-bye.
Thank you, Speaker.
Thank you.